Hi, everyone, and good afternoon. We're going to go ahead and get started because there's a lot of information to go over today. So I want to welcome you all to the new PSYCKES Features Release 8.1.0 webinar. My name is Michelle Rahm. I'm on the Medical Informatics team within the Office of Population Health and Evaluation, and I'll be going over today's training today. So just a couple of housekeeping items I wanted to go over. All phone lines are automatically muted when you join the WebEx, but you can still ask your questions during today's training by going to those three horizontal dots on the bottom right of your screen, and you should see a Q&A option there. And you can submit to all panelists, and we ask that you don't use the chat function. Instead, just use the Q&A function since we won't be monitoring chat today. And then lastly, slides and the recording link would be emailed to all attendees after the webinar and also posted to our public PSYCKES website shortly. And just because of the amount of information we have to go over today, I'm going to be saving all questions for the end of the webinar, but again, feel free to chat them in as we go, and I'll make sure to try to get to most of them at least at the end of the webinar. All right, so here's our agenda for today. We'll do a brief PSYCKES overview, and then we'll get into the meat of our training. So we have a number of new features that went live with our release 8.1.0. So we'll talk about the new high fidelity wraparound likely eligible flag. We have high mental health need flag updates. We'll also go over the new race and ethnicity column in the recipient search results. And then we have a new crisis services section in the clinical summary. So we'll show what that looks like. We've also added the e-sign consent to our usage reports. We've updated the health home consent logic to now include CCOs. We've broken out the New York City region into 5 counties and statewide reports. And then we'll discuss our events episode-based quality flags. And then at the end, I'll just touch base on some training materials and also how to get some technical support for any login or database questions that you might have. Okay, so we'll get right into our PSYCKES overview for today. So what is PSYCKES? PSYCKES is an online web-based application that's both secure and HIPAA compliant. And the purpose of PSYCKES is for sharing Medicaid claims and encounter data along with other state administrative data. And what PSYCKES does is it puts all of this data into a user-friendly format to help support clinical decision-making, care coordination, and quality improvement. And we have ongoing data updates. We have our client-level clinical summary, which is updated on a weekly basis. And then we have our quality indicator reports, which are updated monthly. Now, we have over 11 million New York State Medicaid enrollees currently or previously enrolled in Medicaid in the application. And that includes those who are fee-for-service, managed care enrollees, or those who are dual eligible. But I just want to make a quick note about the dual eligible individuals, meaning those who have both Medicare and Medicaid. At this time, anything paid for by Medicare would not show in the application, but anything paid for by Medicaid data would show. And then within that Medicaid bucket, they also have to be part of the behavioral health population. So that means they have a history of psychiatric or substance use service, psychiatric or substance use diagnosis, or any psychotropic medication billed to Medicaid. But once they're in that Medicaid behavioral health population bucket and they're in our application, the information that you'll see for them would be across the treatment spectrum. So that includes information on general medical, behavioral health, outpatient and inpatient services, residential, even dental and vision information. Now, we have a number of data sources that feed into our application. We have the client-level clinical summary that provides up to 5 years' worth of data, and again, that's updated on a weekly basis. And we have 2 main buckets that we're getting our data from. So the first bucket would be Medicaid fee-for-service claims and managed care encounter data across treatment settings. And then the second source of data that we're getting is from other state administrative databases. And with these 2 big data sources combined, that provides a really full picture of the client, a full clinical picture. Now, with the Medicaid billing data, I want to mention that there is a time lag, which can vary depending on a couple of things. So the first is it depends on the type of information we're getting. So something like pharmacy claims, those are quick and timely and usually show up within 2 weeks from the time the client picked up their prescription to when it hits our application. But other services paid for by Medicaid, like inpatient and outpatient services, those can take a little bit longer from the time the service occurred to the time that you'll see it in PSYCKES. And this can be upwards of 4 to 5 months in some cases. So it just really depends on how quickly providers bill for their services, and then that goes to the managed care company. And then the managed care company gets that information and submits it to the Department of Health. So it really depends on how quickly each of these organizations turns those bills around. But once the Department of Health captures that information, then we get a weekly feed of Medicaid data from them. Now, besides the Medicaid billing bucket, like I mentioned, we have other state administrative databases that feed into PSYCKES, and these are considered more real-time because the lag here for this data is 0 to 7 days. So here we have a list of the different data sources that we have. I'll touch on a few of these. The first being our newer data source, so that would be the New York City Correctional Health Services data, and that includes information on provider name, jail admission date and discharge date, release to, placed in jail mental health residential treatment if applicable, any behavioral health diagnoses, and then if there's a scheduled follow-up or referral. And then we also have New York City Department of Homeless Services, and this provides us with the shelter name, the program type and placement date, the exit date and exit reason, and along with that, we also get the shelter director contact information. Now, something that is quite useful to a lot of our users would be the health, home enrollment, and care management provider information, and we're getting that from DOH MAP. We also have State PC Center electronic medical records. So if a client has spent some time in a state PC and their state PC unit doesn't bill Medicaid directly, we'd still have access to that information because that's one of our data sources. And then going down the list a little bit, we have some information coming from NYMERS. So this is going to show suicide attempt data, and this is actually one of the instances in PSYCKES where this suicide attempt information would not be restricted to that 5-year clinical summary look-back rule. So suicide attempt information is all available data, meaning even if an attempt occurred 10 years ago or 12 years ago, that would still show up in the client's clinical summary. And then the last thing I'll mention is we have safety plan screenings and assessments. Those are entered into PSYCKES by providers within the My Choice application. All right, so we also have quality indicators, otherwise known as quality flags, in the application. So OMH has identified a number of health conditions or treatment issues that are important enough that they've deemed are worth scrutinizing. So what PSYCKES does is it tracks these clients who are positive for one or more of these health conditions or treatment issues. And these flags can really assist with supporting clinical review as well as quality improvement. Now, right now we have, I think, over 110 quality indicators in our application, so this is a very short, brief list of some examples. But just some I wanted to point out are our health home-related quality flags. So an example of this would be eligible for Health Home Plus, no Health Home Plus service in the past 12 months or the past 3 months. And then we have medication-related flags. So an example of this would be polypharmacy. So this could be somebody who is on multiple antipsychotics or multiple antidepressants. And then we have low adherence flags, and an example of this would be a client who has schizophrenia and started an antipsychotic medication, but they didn't remain on that medication for 80% or more of their treatment period. Then we have our acute care utilization or hospital-related flags. One of which is our high utilization indicator set, and that looks at clients who have had multiple hospitalizations within the past 13 months. And then readmissions flags, those look at clients that might be cycling in and out of hospitals. Then we have general medical. So a couple of examples of these types of flags would be no diabetes screening with schizophrenia or bipolar on an antipsychotic, or if a client has had no outpatient medical visit in the past year, they would be flagged for that as well. And then the last bucket I want to bring up today is our performance tracking measures. These are coming to us from the Department of Health and are run with an intentional 6 or more month lag to allow for complete data to come in. So a couple of examples of performance tracking measures would be no follow-up after mental health inpatient, 7 or 30 days, and then no follow-up after mental health ED visit, 7 or 30 days. All right, that was our PSYCKES overview. So now we'll get right into our new features that were just released. The first feature I wanted to go over today was the high fidelity wraparound likely eligible flag. So just to explain a little bit about what high fidelity wraparound is, it's a research-oriented, evidence-based care management approach that's been proven successful with children who have SED, serious emotional disturbance, with significant cross-system needs. And those cross-system needs include mental health needs that have led the child to be admitted to or at imminent risk of long-term hospitalization or out-of-home placement or treatment. So to identify individuals that are likely eligible for the high-fidelity wraparound services, we've created a brand new flag that's been added to recipient search high-need population filter dropdown. It's been added to our high-need, high-risk advanced view and the clinical summary notification section. And that flag is called high fidelity wraparound likely eligible. And this flag is updated on a weekly basis. So I just want to talk about what this flag's criteria is. So the first section we have is the required criteria, which is children and youth ages 6 to 21 who are currently health home enrolled and have a current K3 serious emotional disturbance status or 2 mental health diagnoses within the past year. So in addition to meeting that required criteria, the child or youth must also meet at least one of the following factors. So they must meet currently or in the past year, have a K3 SED, currently in the past year received 1 or more of these services. So that includes a psychiatric inpatient service, residential treatment facility, children's community residence, residential SUD treatment, Youth Act, day treatment, partial hospitalization, home-based crisis intervention, or mobile integration team services. And then the last 2 factors include currently or in the past year received 2 or more crisis services, or currently in the past year attributed to foster care. So that's the criteria for the new high fidelity wraparound likely eligible flag. And I'm just going to show next where that's located in the application. So now we're in a recipient search, and you can get to this screen by going to the purple navigation bar at the top of the page. And once you're in recipient search, you'll go to the special population section and select the high need population filter dropdown. So you can see highlighted here underneath OP, WDD, New York Start eligible, and above Health Home Plus eligible, that's where the high fidelity wraparound likely eligible flag exists. So we're going to do an example search using that new filter. And here's our results page. So you can see the criteria that we've selected at the top. So I'm Main Street Agency, and I've run a search for individuals I'm serving that meet criteria for that high fidelity flag. So you can see 726 children and youth meet that criteria. So here on the results page, we've scrambled the identifying information since this is a training. But what you'd see is the individual's name, their Medicaid ID and date of birth, their gender and their race and ethnicity, any active quality flags that they meet criteria for, their managed care plan, and their current PHI access. Now, if you have the appropriate level of access, meaning consent or emergency access, then you can drill into a client's clinical summary to view more information. Another option is to export the results page to PDF or Excel. And then the last option I want to show is you can also switch to one of our advanced views. So in the arrow pointing to that view dropdown at the top of the screen, this is what we call our bulk population management views. And if you're curious about what's included in each view, basically these views add on more columns to your results page. You can click on that little eye icon next to the word view, and it'll show you what's included in each advanced view. So in this example, I'm going to go to the high need, high risk advanced view. So you can see additional columns have been added to my recipient search results page, such as OPWDD New York Start eligible and Health Home Plus eligible. But what I want to point out is that new high fidelity wraparound likely eligible column. So that will help users identify in this advanced view if any of the recipients have applicable criteria for that flag. And these can also be exported to Excel or advanced views. Now, the last thing I want to point out about the high fidelity flag is the clinical summary. So here we've drilled into a client's clinical summary that meets criteria for the high fidelity flag. And you can see in the notification section, it will tell you how this person meets criteria for that flag. So in this example, this individual has 2 or more crisis services in the past year, in addition to meeting that required criteria. All right, we're going to move along to our high mental health need flag updates. And as I said, please feel free to ask your questions using the Q&A feature, and I'll make sure to get to them at the end of the webinar. So with this past release, we've made some updates to the existing high mental health need flag so that it more closely aligns with the Health Home Plus eligibility criteria, and that's really to help identify those highest need individuals. So what I want to point out here on this slide is the main difference between the high mental health need flag and the Health Home Plus eligibility criteria. So the high mental health need flag captures Health Home Plus service or intensive mobile treatment IMT services within the past year with a mental health diagnosis. And the high mental health need flag does not exclude clients under 18 or clients who reside on a state PC campus. So those are the 2 main differences between the high mental health need criteria and the Health Home Plus eligibility criteria. And then the last thing I want to note is that the high mental health need flag is updated on a weekly basis. So here's the full list of the high mental health need flag criteria. So it's individuals with 1 or more of the following, and that includes AOT active or expired in the past year, ACT active or expired in the past year, IMT in the past year with a mental health diagnosis, 3 or more inpatient mental health stays within the past 13 months, 4 or more ER visits with mental health in the past 13 months, 3 or more inpatient medical visits in the past 13 months, and they have schizophrenia or bipolar in the past year. If they were ineffectively engaged, meaning no outpatient mental health service in the past 12 months, and they've had 2 or more inpatient mental health or 3 or more ER mental health visits, state PC inpatient discharge in the past 12 months, CNYPC release in the past 12 months, and then lastly, a Health Home Plus service in the past year with a mental health diagnosis. And again, these slides will be sent out to everybody as well as posted to our website, so you can reference this criteria there or in the application. Okay, so I want to show where you can find the high mental health need flag. There's 2 locations this flag lives in recipient search. So you can find it in the special population section. And if you expand that population filter, you can see it's highlighted here. It's the last choice on your list. And it's also located in the recipient search quality flag section. So it's beneath the Health Home Plus related quality flags. And if you ever need a reminder on the criteria, like I said, we'll send out the slides and we'll post them to our website. But you can also click on that blue definitions hyperlink at the top of the quality flag section. And then you can export those definitions to PDF, and the high mental health need criteria will be listed there as well. All right, so here we've run an example search using that high mental health need flag as Main Street Agency, and I can see that 2,332 recipients meet this high mental health need flag criteria. So here I can either drill into a clinical summary if I have the appropriate access to view how they're meeting criteria. I can export this list to PDF or Excel, or I can switch to an advanced view. So I'm going to drill into a clinical summary. And in the clinical summary, similar to that high fidelity flag I just talked about, I can find the high mental health need criteria that was met for this person in the notification section. So here I can see that this person meets criteria for this flag due to having 4 or more ER mental health visits in the past 13 months. They've had ACT, active or expired in the past year, and then they've had IMT active or within the past year. The other section in the clinical summary you can find the high mental health need flag and criteria is the quality flag section. And something I want to point out here is you can toggle to a graph view for the quality flags to see a history of how long this person has met this flag's criteria, or for any of the other flags, how long they've met criteria currently or in the past. All right, we're going to move on to the race and ethnicity column in recipient search results. So we've added a brand new race and ethnicity column to our recipient search results page, and that's for both the individual and group cohort searches, as well as to our advanced views. So that includes our care coordination advanced view, high need, high risk, high utilization, and the outpatient providers advanced view. And just a reminder, the race and ethnicity data is coming to us from Medicaid billing. So here's an example of what that looks like in the application. So I run a group cohort search as Main Street Agency for the Health Home Plus eligible individuals I'm serving. So we have the client's name, their Medicaid ID, date of birth and gender, and then highlighted here is the newly added race and ethnicity column. What I want to point out is I can also switch to our advanced views on the top right of the screen. And even though more columns were added, we still have that race and ethnicity view included in our advanced views. All right, so we're moving along to the crisis services section in the clinical summary. So we have added a new crisis services section, which is located between the medical outpatient services and the hospital ER section. And we do want to note that the crisis services were always in the clinical summary, but they were previously rolled up under the hospital ER section. So we've extracted those and given them their own crisis services section. And this new section includes information on service type, provider, admission and first billed date, discharge and last billed date. You can see the number of visits and length of stay, their most recent primary diagnosis, and then their most recent procedures. So just to show what this looks like, we're in the clinical summary, and here's an example of that new section. So we can see here under the service type column, this person received residential crisis support, they've received mobile crisis follow-up, CPEP mobile crisis, and even CPEP mobile crisis telehealth. And again, here you can see the provider that administered these services, the associated dates, the primary diagnosis they received, and the procedures. You can also drill in to a specific service, or if you click on the details button next to the crisis services section label, you can see all applicable crisis services. And in that drill in, you can also see if any other diagnoses were given during that service in addition to the primary diagnosis. And then the last thing I want to point out is that arrow pointing to the top right of the section, you can toggle to a graph view to see any crisis service treatment patterns. All right, so we're going to go into the e-sign consent added to usage reports feature. Now, with this latest release, when a client e-signs a PSYCKES consent form within our iOS PSYCKES mobile app, this e-signed consent form would now be reflected in our usage reports. And then with this update, we've also added to our usage reports the DOH Health Home Patient Information Sharing Consent. So that really allows for a more accurate consent count and access level descriptions. So the two reports that this affected was the PHI Access Module usage report. So that will now include both the e-signed PSYCKES consent and the DOH Health Home consent within the signed consents bucket. And then the clinical summaries usage report. So that will now display the appropriate access level in effect for the e-signed and health home consents. So I'll show what that looks like in the application. So here's how you get to the usage reports. You'll go to that navigation bar at the top and select the usage dropdown. And the first report we'll review today is the PHI Access Module usage report. And here's the PHI Access Module usage report. And for all of our usage reports, your provider name will be pre-populated, but you can select from a specific date range or, in this case, current user details, such as a role or a setting. And so in this example, we're just going to leave this blank and click Submit. And then here's our PHI Access Module usage report. We have in the top, in that gray bar, our filters that we've selected, if any, and then a summary of graphs for PHI Access Module usage. We have the total number of clients entered during the date range, and then a table showing PHI Access Module usage by user during that date range. So with our latest release, we're now including in the highlighted signed consents buckets that e-signed PSYCKES consent along with that DOH Health Home consent. So the counts will reflect a more accurate number of the signed consents that have been obtained at your agency. Okay, the clinical summaries usage report, again, your provider name will be pre-populated, and here you can select a date range. You can also select current user information, such as a user ID, the user's name, and again, their role or setting in your organization. And then you can also input recipient information, such as a last name or Medicaid ID, to view clinical summary usage on a specific client. But again, in this example, we're going to leave these filters blank and click Submit. So in this report, we can see the unduplicated count of clinical summaries that have been viewed during that date range and the unduplicated count of users who access clinical summaries. So with this release, for anyone that has an e-signed consent, you'll be able to view them in this report, and the access level and effect columns that are being pointed to here will display all data consent. And then for anyone who has a health home consent, that would show health home consent in the access level and effect column. And these reports you can export to PDF or Excel. All right, so we're going to go into the update to health home consent logic to include CCOs. So with our latest release, CCOs, care coordination organizations, are now able to utilize that DOH Health Home Patient Information Sharing Consent option within the PSYCKES Enable Access module. And this is because we've removed that requirement of an agency needing to be in the DOH MAP system as a health home or a care management agency. So for CCOs to be able to utilize this checkbox, two things need to happen. So one is that there has to have been at least one CCO case management service billed in the past year. And the other one is that the CCO user needs to indicate in their user role profile that their primary work setting is a health home administration or a CCO. So I'm just going to show how to update your user role profile in the next few slides. So here we're logged into PSYCKES, and you can click on that settings dropdown located on the top right of the screen, and then select Update My User Profile. And then in the first section, that's your primary work setting, you'll need to select Change Setting on the far right if it's not already showing Health Home CCO. And then you'll select the Health Home Administration CCO option and then click Continue. And so next you'll see the updated work setting that you've just selected on your user role profile. So what you'll do next is just scroll down to the bottom of the profile page. And then you can click Continue to PSYCKES to save your changes. So once those two criteria have been met, here's how you can look up an individual client and enter that DOH Health Home consent as a CCO user. So in recipient search, we're going to that top section for recipient identifiers where you can search for an individual client using their Medicaid ID, their Social Security number, or their name and date of birth. And in this example, we'll just search using their Medicaid ID. And here on the results page, you can see the client's name, their gender and age, their Medicaid ID, their date of birth, their race and ethnicity, their address, any active Medicaid quality flags they meet criteria for, their managed care plan, and then their current PHI access level. So you can see this person right now has no access. And you'll want to confirm you found the correct client before proceeding. So once we've confirmed this is who we're looking for, we can click Enable Access on the far right-hand column. And then you'll see our Enable Access module. So again, if those two criteria were met, meaning that there's been at least one CCO case management service billed in the past year, and the CCO user indicated Health Home Administration / CCO in their user role profile, then that DOH Health Home consent box will be clickable. So here we'll select that DOH consent option and click Next. And then you'll just confirm again that this is the correct person you wish to enable access for and attest to how you know it's the correct person. And once that's done, you can select Cancel. If you don't want to continue with enabling consent, you can select Enable to enable consent and go back to recipient search, or you can select Enable and view clinical summary to go right to their clinical summary. And just a quick screenshot of what that looks like once consent has been enabled. So now you'll see in the current PHI access column for that recipient that you have Health Home consent. Okay, so we're moving on to the New York City region broken into 5 counties and statewide reports update. So in statewide reports, the New York City region has been broken out into the 5 New York City counties within the client and provider county filters. And the 5 New York City counties include Bronx, Brooklyn, Manhattan, Queens, and Staten Island. So I'll show what that looks like in the application. So in the purple navigation bar at the top of the page, we selected statewide reports, and then you have to select an indicator set and indicator type. So in this example, we've done the high utilization summary measure. Now what I want to point out is the client, residence, and provider location filters. So if New York City is the region that is selected here, then in the county dropdowns, the applicable New York City counties will show. So I'll do an example search here. So I'm in the client residence filter, and I'm selecting New York City as the client region. And then you can see in the client county dropdown, I have all 5 county options. So in this example, I'm going to select the Bronx option, and then I'm going to hit Submit to run my report. So here you can see your filter selections you've made at the top of the page, and the client region and client county tabs below will reflect your selections of New York City and Bronx. So if we drill into client county, for example, that tab located at the bottom of the screen, that would only show Bronx due to our filter selection. So if we drilled into that Bronx county, that would show a list of providers that clients residing in Bronx County are receiving services from. So you can also export these reports to PDF or Excel as well. Okay, I think we're moving along pretty well. The last new feature that I want to go over today is the events episode-based quality flags. So historically in PSYCKES, the measure numerators and denominators were based on the count of unique individuals. So with this latest release, we've begun what we call phase 1 of transitioning some of the existing quality flags from individual-based counts to events or episode-based counts. And with phase 1, certain DOH-run performance tracking measures will now capture each separate event or episode, for example, hospitalizations, to calculate a measure's numerator and denominator. So I'm going to go over what measures were affected first. So we have our mental health performance tracking measure set. So these measures that you see on your screen have transitioned from individual-based counts to events and episode-based counts. So we have no follow-up after mental health inpatient or ED visits, 7 and 30 days. We have no engagement after mental health inpatient, and then no intensive care management after mental health, ED, or inpatient visit measures. So these are now events episode-based measures rather than using individuals. And then we have our substance use disorder performance tracking set. So here we've switched the following measures from individual-based counts to events episode-based counts. We have no continuity of care after detox or rehab to lower level of care. No follow-up after high-intensity care for SUD within 7 or 30 days. We have no initiation or engagement in SUD treatment. No initiation or engagement in OUD treatment. And then no follow-up after SUD-ER visit within 7 or 30 days. And then finally, we have some vital signs dashboard measures for both the adult and child sets that have switched from the individual-based counts to the events and episode-based counts. So I just want to go into the application and show what I'm talking about here. So we're in My QI report. You can get there by going to the purple navigation bar at the top and clicking My QI report. And here I want to specifically point out the DOH performance tracking measures bucket, which is located towards the bottom part of the screen. So these measures, again, have that intentional 6 or more month lag to allow for complete data to come in. So I'm going to drill into the MH performance tracking measure set in this example. And here I want to show that we've updated the eligible population column towards the top of the page that's highlighted. So originally this said eligible population, but now we've switched that to eligible population / episode to help notify users that some of these measures are based on events or episodes rather than individuals. And another way to tell what measures have been affected is by their hover over text. So in this example, we've hovered over no follow-up after mental health inpatient 7 days. So the hover over text reads the percentage of mental health inpatient discharges among individuals ages 6 years and older that are not followed up by a mental health outpatient visit within 7 days after discharge. So this shows me that this measure is looking at inpatient discharges, meaning the event or episode, rather than the number of individuals. So this is what I want to point out on this screen. We've zoomed in on that no follow-up after mental health inpatient 7-day measure. And in the eligible population / episode column, we're seeing the number 1,671. So that is the number of mental health inpatient discharges. Now, out of that 1,671 mental health inpatient discharges, 828 of those are the number of discharges that had no follow-up within 7 days. So as a reminder here, for this measure and other measures that are now events episode-based, the number with QI flag column is not reflecting the number of clients flagged, but the number of the number of discharges meeting that flag's criteria, rather than based on the individual. And then if I drill into that flag, the no follow-up after mental health inpatient flag, we're brought to the recipients tab. So this tab is going to show you the number of recipients who meet criteria. And the number of recipients is going to differ from the number of discharges that you saw on the previous screen because, again, people can have multiple discharges per recipient. So when drilling into an events episode-based indicator, it's important to remember that the recipients tab is looking at the number of individuals flagged whose discharges met that flag's criteria. All right, so we're nearing the end of the webinar. I'm just going to go over some training and technical support. So we have a number of PSYCKES resources available on our public website, psyches.org. But if, of course, you have any questions regarding the PSYCKES application, you can reach out to our PSYCKES Help Desk. We're available Monday through Friday from 9 to 5 at psyches-help@omh.ny.gov. But if you're having any issues with your token or logging in, we have the ITS or OMH Help Desk who would be able to assist with that. So the ITS, which is the OMH and State Employee Help Desk, would like folks to contact them via chat, that chat link there, or call 844-891-1786. And then for non-OMH and non-state PC employees, you can contact that health help email you see on your screen or the number associated with that. All right, so I'm going to open it up for any questions that came in during today's webinar.
Michelle, we haven't received any questions yet, but I know there is still some time, so I am watching the Q&A box if any are sent in.
Okay. Thanks, Melanie. We'll give it another minute or so just to see if any folks had any questions about any of the material that was covered today or any questions related to PSYCKES in general. I'll check the chat too. Not seeing any in the chat either. Oh, it looks like we might have one coming in. Oh, I'm seeing a couple came in. I can go ahead and start answering some of these. So someone asked for the items uploaded monthly, is it at the end of the month or the start of the month? So that's a great question. We have what we call a monthly refresh that's done at the end of the month. So for example, our quality indicator reports are updated monthly, and that update usually occurs towards the end of the month. And then once our QA testing and our refresh is done, we send out a notice to all of our users letting them know that the monthly update occurred. When a client does not accept the health home, how do we report that? I'm not sure if I'm understanding that question. I'm wondering if you're asking when the client does not want to give DOH Health Home consent, how do we report that? I believe the consent form would have a deny consent option. Oh, it's something else? Okay, misunderstanding then. If you could provide some more information on that, that would be helpful.
Michelle, that might be a question that's more related to the DOH side of things. If someone's not accepting health home and regarding like the
services
of that, that's not something that the PSYCKES application would be able to assist with.
Gotcha. Thanks, Kristen. All right, so those were the only questions I saw so far. And again, if any questions come up while you're perusing the application, we have our PSYCKES Help Desk who provides a response within 1 business day, so please feel free to reach out to them. And I'll go ahead and make sure to send out all the slides and the recording link to all attendees. And I wanted to just thank everybody again for joining today, and I hope you all have a wonderful rest of your afternoon. Thanks.